Azithromycin is an antibiotic used to treat bacterial infections. It does not treat the common cold. It is taken with food or in an empty stomach. If taken with food, avoid dairy, antacids, or multivitamins. Contact a physician if any signs of an allergic reaction occur, such as shortness of breath, rash, and swelling of mouth and face. Some common side effects include diarrhea, nausea, abdominal pain, or vomiting. Contact your doctor if you continue to experience diarrhea after finishing treatment. Do not skip doses or stop your medicine early, and make sure to take it as directed.
Children's Motrin Luga can be used in children 6 months to 12 years of age to help reduce fever and mild to moderate pain. This medication should be taken by mouth as directed based on child's weight every 6 to 8 hours. Now, please take a moment to type in your child's weight in pounds so an appropriate dose can be provided. Please use the provided dosage cup and do not use household items for dosing measurements. Stop the use of this medication and contact your healthcare provider if you see your child's symptoms worsen within the first 24 hours. Please shake this medication well before use.
Aspirin is a pain reliever that can also be used to prevent heart attacks, strokes, and inflammation. It is important to note that a daily aspirin regimen for heart health should not be initiated unless directed to do so by your physician. You should take this medication by mouth with a glass of water. While taking this medication, you may experience some side effects such as upset stomach and heartburn. This medication also has the potential to cause bruising and bleeding. If this occurs, you should contact your doctor immediately. You should refrain from smoking cigarettes and drinking alcohol to avoid irritating your stomach. Aspirin should not be used in children to treat symptoms of chickenpox or flu.
Plan B one-step or the morning after pill helps prevent pregnancy if taken within 72 hours following unprotected sex. However, the sooner it is taken, the more effective it will be. If vomiting occurs within 2 hours of taking this medication, you have the option of taking a second dose. When used as directed, Plan B one-step is generally safe and effective. It contains levonorgestrel, which is the same medication contained in many birth control pills. While taking Plan B one-step, you may experience headaches, nausea, breast soreness, dizziness, and abdominal pain. Plan B one-step should not be taken if you are already pregnant or breastfeeding. This should be not taken as a regular birth control method because it is not effective. Plan B one-step does not protect against HIV or AIDS or any other sexually transmitted diseases.
Benadryl is used to relieve allergic symptoms such as itching, swelling, and hives, and can also be used for trouble sleeping. Take 1 to 2 tablets every 48 hours for allergies and 2 tablets before sleep for no more than 2 weeks for insomnia. Benadryl may cause significant drowsiness and effects such as dry mouth, constipation, flushed skin, confusion, and disorientation, especially in the elderly. Avoid driving and doing other tasks that call for you to be alert until you know the full effects of this drug. Avoid drinking alcohol while taking this drug. It can be taken with or without food. Take with food if causes an upset stomach. This medication should not be used in children under 12 years of age without consulting a pediatrician.
Prednisone is an anti-inflammatory steroid that helps to suppress the immune system. It can be taken with food to avoid upset stomach. Consult with your doctor before taking this medication if you are pregnant or breastfeeding. Prednisone can interact with vaccinations and medications such as Advil and Aleve. You should also notify your doctor if you're on warfarin, as this can cause an increase in bleeding. Avoid alcohol while on this medication. This medication may also cause mood swings and blood sugar fluctuations, increased liver enzymes, increased blood pressure, and upset stomach, and should be used cautiously in diabetics, children, and those with hypertension.